Hello friends, welcome to Pediatric Basics. First of all, apology. Now this video is about the quiz answers. The apology is because there has been significant delay for various reasons, and one of that was the Middle East war situation. So what we will do is, I still want you to try to think about the answers for this question. So the first part, not too long, will be only questions. So think about the possible answers for those questions, and then I will go through the answers towards the end of the quiz. And I'll try my best so that the video is not too long, so that hopefully you'll just not have learned something, but enjoy as well. So the first question from the quiz was about the iron deficiency anemia and correlation with platelet count. So actually it can lead to all the three things: normal platelets, or they can be high thrombocytosis, which is not uncommon, but the rare or uncommon problem is the thrombocytopenia. One of the differential diagnoses could be Evans syndrome, where it's autoimmune condition affecting both the red cell as well as the platelets, which is quite rare in pediatric age group. Magnesium sulphate in acute asthma management. The answer is very simple to this question, and that is it can be used intravenously as well as by nebulizer. You can give both the modes of medication in one patient. But remember, for subsequent doses of intravenous magnesium, you may need to monitor magnesium levels or be in touch with the intensive care specialist. Causes for huge cardiomegaly. Often in an exam, it is asked along with an X-ray showing a huge size of the heart, and the answer is all of the above, which is abstinence anomaly, chronic congestive heart failure, dilated cardiomyopathy, severe chronic anemia. The question: 7-year-old child, how would you treat him with a bronchodilator and the preventer? The answer is very simple. It has to be given via a spacer device. There is no role of direct inhaler, and there is practically no role of any oral bronchodilator or oral steroid in chronic asthma. Diagnostic test for asthma. So none of these are actually diagnostic of asthma, and a lot depends on your history taking. Uh, Investigations like spirometry and pheno, they are definitely supportive and useful in the management as well, but they do not diagnose asthma. Knowing about fetal circulation is an important aspect of various neonatal problems, especially cardiovascular problems. So, this question, which is saying that what is the incorrect statement out of all this, and then they all are correct statements. So, the answer is none of the above. So the question was, what is this device? So this is actually not a peak flow meter. This is the device to check the inhaler technique, and it can also be used to train with regards to use of the uh, correct use of the inhaler. Maternal diabetes, especially when it is poorly controlled, can cause significant problem in the babies. In terms of the cardiovascular problem, all of this which is mentioned here, they can happen in infant of diabetic mother, the most common being the hypertrophic cardiomyopathy. So heart failure in infant and children, From the causes, I think except for phallostatology, where it is quite rare unless it is complicated by some other problems like severe anemia, all other reasons they can lead to or may cause heart failure in children. As of now, in MART regime, only formoterol can be used as a bronchodilator because of its quick action and then longer duration of action. This is not there with other bronchodilators. If you want to know a bit more about MART regime, please do watch a video on that. Thank you so much to all of who have attempted this quiz. There are definite winners, and we have decided that we will split the winning prize between the two winners. And also, thank you to you all who watched this video. I hope you have initially gone through the questions before going through the answering part of the video. Please do watch our videos, subscribe to our channel, share it with your colleagues. Thank you so much once again, and best wishes.